Moses Egesa, diagnosed with type 1 diabetes at just 15 years old, has been living with the condition for over a decade. Egesa shares the struggles his family faced when managing his diabetes as a teenager.
It was expensive to my family because buying insulin, I used to rationalize my insulin so that at least I can spend one vial to take the whole month.
Now at 26, he is determined to help other young people facing similar challenges.
Meeting my fellow peers at the clinic, it really impacted me to advocate more because they all had different stories that I saw that even their stories were more challenging than mine.
Ramadan Masete, a warrior coordinator at Mbale Regional Referral Hospital, was diagnosed with type 1 diabetes in primary 6. He recalls how misdiagnosis, stigma and culture myths nearly cost him his life.
My father didn't believe because he reached an extent of saying that in our family we don't have anyone with diabetes. I think it is just a curse.
Masete is now advocating for better access to comprehensive, affordable and high-quality treatment for those living with type 1 diabetes. The Warrior Training Workshop in Kampala brought together over 50 young adults with type 1 diabetes from Uganda, Kenya, Tanzania, Zambia, Zimbabwe and Ghana. The event also featured medical experts and focused on building skills for both managing the condition and leading within their communities.
The sole goal is to empower our warrior coordinators at the clinic to work with their nurses and the village health teams to raise awareness for type 1 diabetes. What are the signs and symptoms?
The warrior coordinators help other medics in 35 diabetes clinics across the country, with some stationed at regional referral hospitals.
They create awareness in the villages where they are, the communities, to help people because we understand there are many who are dying down there silently without knowing what is killing them.
Dr. Theresa Piloya, a pediatric endocrinologist, explains that type 1 diabetes is characterized by the body's inability to produce insulin.
The children do not produce a hormone called insulin. If they produce it, it's very, very little. So their pancreas does not produce that hormone.
Dr. Piloya also addresses the myths and stigma that continue to surround the disease.
Our community thinks a child cannot have diabetes. If your child drinks a lot of water, your child is eating a lot but not gaining weight, passes a lot of urine, please ask for blood sugar like you ask for a malaria test. It could be life-saving.
One of the key focuses of the workshop was the use of continuous glucose monitors, CGMs, a cutting-edge technology that allows real-time tracking of glucose levels. These devices, though widely available in developed countries, are still a rarity in sub-Saharan Africa due to their high cost and limited availability.
Continuous glucose monitors world over have shown to improve diabetes care. They've improved the numbers in regards to people making correct decisions.
Vivian Nabeta, the Executive Director, Sonia Nabeta Foundation, explains the importance of providing holistic care for children with type 1 diabetes.
A Uganda where children with type 1 diabetes have an equal chance at a long, healthy, gainful and productive life.
These children, I'm telling you, as you hear the word warriors, they are warriors, because they need to prick 3 to 6 times a day.
Betty Mudondo, NTV Tonight.